Healthcare Manager Profile by Heather Sewer for Healthcare Administration. The healthcare organization I chose to focus on is Dayton Children's Hospital, and I will be going over some of their history. It all began in 1919 with a woman named Anae Barney Gorman. She purchased a building in North Dayton in Ohio, and she began it as a community health center that offered a lunch program, free clinics for neighborhood residents, and therapy classes. From the 1940s to the 1950s, big changes took place. In 1947, the name was changed to the Barney Convalescent Hospital. At this time, the hospital cared for victims of polio. Realizing that there was no hospital around dedicated to only children, a woman named Elsie Mead worked to form the Children's Hospital Society in 1957. This raised money to go towards a children's hospital. From the 1960s to the 1980s, in 1967, it was renamed the Barney Children's Medical Center. And at this time, the Children's Hospital Society joined the Convalescent Hospital. This opened in Dayton, Ohio on February 1967. But then in 1970, the name was changed to the Children's Medical Center. By this time, the hospital had grown into a 155-bed, private, but not-for-profit hospital. In the 1980s, the hospital grew, and it also gained acknowledgement for caring for serious health issues in children. From the Dayton Children's website, it states the hospital cared for conjoined Siamese twins, their first infant who weighed less than 1 pound, and a gunshot wound victim who had more than a quarter of his skull and brain destroyed. From the 1990s until now, they expanded critical care. They received some accreditations. There was a new CEO and president of the hospital, Deborah Feldman. They expanded many of their facilities. During the early 1990s, the hospital focused really on customer service, having quality care, and being cost effective. In the 2000s, the medical center grew. They opened locations in Beaver Creek, Kettering, Lima, Springboro, Sugar Creek, Springfield, Vandalia, and Warren County. In 2012, the name changed again to now what we all know as Dayton Children's Hospital. In July of 2012, Deborah Feldman became the CEO and president, and she is still in those roles today. In 2016, the hospital's tagline was updated to Above and Beyond, which is what they strive for with patients and families. Their mission is relentless pursuit of optimal health for every child within our reach, and their vision is reinventing the path to children's health for families throughout our region and beyond. Healthcare managers. According to the Bureau of Labor Statistics website, medical and health services managers set and carry out policies, goals, and procedures for their departments or facilities. Some of their duties include hiring, scheduling, and evaluating staff, monitoring compliance with state and federal guidelines, and developing reports and budgets. Manager type. The manager type that I chose was transformational management style. According to StatusNet, a transformational manager needs to create a positive, progressive work culture that encourages innovation, growth, and development. Manager role. The manager role that I focused on was pre-service operations. They are responsible for overseeing the processes before the patient is seen. This includes scheduling and registration, insurance verification and authorization, HIPAA compliance, staff coordination, and patient communication. Leadership, management, and communication. Types of leadership include coercive, participative, pace setting, and coaching. The healthcare manager within Dayton Children's Hospital should be participative due to asking for input and allowing decision making. This will help managers be more productive, and then they will be respected and valued. Skills that I would like to see in a manager are motivational, respectful, and caring. Effective communication is an important skill for managers to have. This will help the manager with better decision making, team collaboration, resource management, ensuring compliance with regulations, and help with crisis management, which was found on the University of Minnesota website. Here is a chart found in our book focusing on leadership versus management competencies, and you can see the differences between the leadership competencies and the management competencies. Overall, I feel like the healthcare organization that I have chosen, Dayton Children's Hospital, has an impressive history and has done great things for children and families in the Dayton area. Any manager that wants to use these skills and help employees reach their goals while making a difference would be an asset to Dayton Children's Hospital. Thank you. Here are the references used in this PowerPoint.